My name is Dana Weber, Transformation and Quality at the US Oncology Network.
I have a vanilla latte with almond milk for Dana.
Look forward. My dad was an obstetrician gynecologist and had a private practice when I was growing up. So I joke that I was raised in the doctor's lounge. But I think a lot of, those experiences of my dad taking care of people definitely impacted how I saw my purpose, in wanting to take care of people. I started my career as a pediatric oncology nurse. You get to bear witness to this incredibly significant moment in their lives. Really high highs can be really low lows. But you really get to share a special piece of somebody else's life. And I think that that's probably the biggest thing that I carry forward. If you can understand how you took care of people, you can really understand, okay, if I'm working with a practice, this might be a similar challenge. So let's work through that. A lot of my team's job is driven by value-based care. And value-based care is really a challenge to the fee-for-service model to overall try to lower the cost of care for patients while maintaining high quality, good patient care. I really think that we try to look at it from every angle and make sure that we're giving the practice all of the support in every single area, from measurement, from building the workflow, from the initiative, delivering the education. We want to take the guesswork out of it for them. They're busy enough. Over the last 2 years, I've been helping to shepherd our access to care initiatives for the network. And so access to care under that umbrella is really, how are we assessing the needs of the patients for health-related social needs, and then what are we doing to address them? We've had so many practices be really creative in meeting the needs of our patients. We've had one practice who recognized that many of their patients had a food insecurity. And so they built a food pantry in one of their cabinets in their clinic upstairs. And they know that they don't need to just treat people's cancer, but they are really integrated as a key part of the community. And so they really wrap their arms around these people and want them to be as successful as they can. I had a boss/mentor at one time. We had a conversation because moving away from patient care is always a challenge. You're not front row seat anymore. And she said to me, you get to take care of the people who are taking care of the people. And so that's always really resonated with me is, how do we support the staff that are doing the work? How do we support the practice? How do we support the physicians that are doing the work? I want to make sure that people know that getting care in community cancer is top-notch, top tier. We're delivering state-of-the-art care in communities, and I want people to know that, and I get to do it.